Tonight, we're talking about FASD and sensory challenges. We're very lucky to welcome Heather Hudgens-Chan with us today. And before that, I just want to make a quick pause to acknowledge the land that we're on. And we do that to really acknowledge our commitment and responsibility in improving the relationships between the nations and to improve our understanding of local Indigenous people and their cultures. So from coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nation people that call this land home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we can, each in our own way, try to move forward in a spirit of reconciliation and collaboration. So thank you. In my case, I'm in Ottawa, Gatineau, land of the Algonquin and Anishinaabe people. So our guest tonight, Heather Hudgens-Chan, is an occupational therapist, and she's registered in Ontario. And after graduating from McGill University, Heather lived in Western Canada for 4 years, and having held various positions in acute care hospitals in Saskatoon and Edmonton, she later became interested in pediatric rehabilitation and early intervention. So after relocating to Ontario, Heather worked in Ottawa as a consultant for schools and worked with children of all ages. And she has traveled extensively to the United States for specialized training in sensory integration and trauma-based informed care. Heather has a specific interest in helping children with sensory processing challenges, coordination difficulties, visual perceptual challenges, all of which contribute to learning difficulties. And she has a passion for working with children of all abilities and believes that movement and exercise are key to physical, cognitive, social, and emotional development for children.
Thank you so much for inviting me to speak, Pascal. I am also coming to you this evening from Ottawa, Ontario. What I'd like to do with this presentation is I'd like to go through some of the objectives that I have for this evening. First off, I'd like to go through the pyramid of learning model, which has been very helpful in my role as an occupational therapist and educating families and caregivers. I will be discussing the 8 sensory systems, reviewing the importance of movement for neurological development of the sensory systems, and I will also outline frequently seen sensory processing concerns seen in children with FASD. I will discuss the differences between sensory challenges in FASD versus other sort of diagnoses. And I will also talk about how occupational therapy can help children, caregivers, educators, and families. I'm hoping to provide you all with some tips for home. And I'd also like to discuss the collaboration between the psychotherapy area and how occupational therapy can be a part of treatment for children with FASD as well. And lastly, I would like to emphasize the importance of advocacy for occupational therapy support in our community, particularly for your children with FASD. This is perhaps one of the most helpful slides. This is perhaps one of the best visuals, I should say, I've ever come across to describe the foundations we need in order to solidify learning. And so at the bottom here, we have the central nervous system, which consists primarily of the brain and spinal cord. And it integrates information, coordination, and it influences all parts of our body. At a very young age, babies are developing their central nervous system, and it's sort of outlined in this diagram that we have here. So occupational therapists, we're kind of known as being detectives. We break down learning and skills needed in order for children to be successful in a variety of daily activities. And this model has been an excellent way for parents and caregivers to understand why there could be gaps in learning. And this is plays a role not only for children with FASD, but also other children as well. I remember seeing a video one time about the concept of learning and how information does not get through. The speaker took a simple bucket with holes in it, which she likely purchased at the dollar store, and she demonstrated with wooden dowels how learning happens. And once each area had developed neurologically, a wooden dowel was put in the hole so that water would not flow out of it. As the child matured, there were more and more wooden dowels put in this container, filling the holes of the bucket, and the water was used to describe how information is provided to the child during learning. As more and more water was poured into the bucket, the water could be blocked by the hole if that skill was integrated for that child. And it held the information, or the water could leak out of the bucket if the level of the hole was not matured. And this is how children learn. We provide information to them. However, if those holes in the bucket are not solidly filled with a dowel, information will leak out and they will not be able to learn. Very important for learning, because important information does not become integrated or remembered. And the child often can get overwhelmed as more and more information is provided to them. And so this diagram, or the concept, is very important when we speak about children with FASD, as we know that children with this diagnosis already have difficulties with encoding information. They have difficulties with memory and other areas, which we will later talk about in this presentation. I'd like to talk about the 8 sensory systems that we have. And we actually do have 8. We have the 5 senses that we all learn about in elementary school. And in addition to those 5 senses here, we also have 3 others that occupational therapists will often talk about. And they are the vestibular system, the proprioceptive system, and interoception. So we're going to talk about the vestibular system. This is the first system to develop in utero. And this is our sense of motion or movement. This system provides our brain with a sense of motion, head position, and spatial orientation. It works with our motor system to allow us to keep our balance, stabilize our head and our body movement, and maintain our posture. It is a complex system which involves the inner ear and the brain communicating together. And so what happens is that the vestibular and visual systems communicate with one another. And this helps to provide our brain with information that we need in order to process movement. And the vestibular system is affected by repeat ear infections. And this is always an important piece of information that we ask during the assessment process. Children with multiple ear infections in early childhood often have difficulty processing vestibular information. Many of these children are fearful of movement or avoid activities that involve a lot of movement. Or they have the opposite concern, and that is that they really don't process that information and they're always moving around. So when the fetus is only 5 months old, that vestibular system is already amazingly well developed. This vestibular system provides the growing fetal brain with a whole host of sensory information as the fetus is rocked back and forth by its mother's movements. The second system I want to talk about is the proprioceptive system. And this is, has a huge influence. This is our body awareness and identifying and grading force and pressure on an object. The proprioceptive system receptors are located in our muscles and our joints and our ligaments and even our skin and bones. And so these receptors are activated when the body is touched. And what happens is that a message is sent to the brain to tell the body where it is in space. And this is quite a complex idea. I'd like to use a little example to kind of illustrate what I'm talking about. So have you ever tried to get up in the middle of the night to get a glass of water without turning on the lights or waking up your partner? And if you've ever done this, your proprioceptive system has been working extra hard. It works along with the tactile system in order for you to be able to get out of bed, navigate yourself to go into the bathroom, and be able to lift the tap upwards, run the water, and use our hands to locate the cup next to us. So we're using our proprioceptive sense, our tactile sense, and our visual memory in order for us to be able to go and find that glass without crashing it down on the counter. And so most of us know exactly where that cup is in relation to our mouth or other objects. And so this is our body awareness in relation to objects and people. Children with FASD often struggle with awareness in that they often overstuff their mouths with food without realizing it. They may push too hard on toys. They may actually break some toys. They may play too hard with their younger siblings. And so they may also stand too close because they don't have a good sense of where their body is in space. This is perhaps the most challenging area of sensory processing for any child with FASD. And then the last sense is the interoceptive sense. This is the least known and understood sensory system, but more and more research is coming out about the interoceptive sense. It is basically our sense of our body's internal state. It's knowing if we feel hungry, if we have to use the washroom, if we're tired. And so children with FASD, they have a very hard time knowing what they need and then also expressing what they need. And so when we work on this sense in therapy, we often target the other sensory systems first in order to get the child relaxed. And then we use activities such as body scans or games to help children make sense of the information that they feel. One very popular activity that I like to use to work on interoception is I purchased a small pulse oximeter. And so what that is it measures the heart rate and the oxygen saturation of children while they're in therapy. And so I once worked with a teenage girl who told the psychotherapist and myself that she felt really relaxed inside. And then when I actually put the monitor on her finger, she really had a high heart rate. And so she wasn't aware of what was going on inside her body. We were later able to get her to breathe and do some deep pressure activities. And then her body responded appropriately. Her physiological response was viewable on the pulse oximeter. And so, children may appear well regulated, however, their heart rate may be quite high inside. And so, when we try and label how they feel, that helps them make connections between, what's going on outside and how they are feeling. So this is an example of an interoceptive activity. Once she was able to understand a little bit more about her body, she was able to discuss with the psychotherapist and myself how that she had learned about her body. And so these sorts of activities are things that we need to practice regularly with our kids with FASD in order for that information to be integrated. I'd like to talk a little bit about how our sensory systems develop. So the sensory systems develop in utero, and they continue to develop as a baby explores the world by moving around and experiencing sensory input. And when the mother walks around, or she moves quickly, or she might turn around if she's dancing, that information stimulates the vestibular system of the baby. And so children that have had mothers who have been through bed rest or hadn't had a lot of movement, or mothers who have had stress or poor nutrition, these sorts of things can significantly affect the sensory motor development of children. And so I'd like to talk a little bit about trauma as well. So trauma can significantly impact the nervous system of the mother and the child. And so exposure to alcohol in utero in itself is a developmental trauma. And we always ask in our initial meeting with families if the mother had a stressful pregnancy and if there was any trauma, as this sort of sets the stage for the nervous system of the baby. And so trauma also can be linked to the birthing process. And we see that a lot of this in our clinic. So if the mother has had a long labor or a C-section, or if the child is born under a lot of stress or has to be urgently evacuated from the mom, then this too can have an impact on the baby's nervous system. It actually would be very interesting for us to do a clinical study of sensory motor concerns of children born to mothers who have had C-sections. And so while this is most often impossible to avoid having a C-section, we see a lot of children born by C-section who come to us with sensory motor issues later on in life, typically around the ages of 6, 7, or 8. And so a lot of these children do have difficulties with attention. They have trouble with self-regulation. They often have bedwetting concerns that haven't resolved in early childhood, or they might have difficulty sitting still. And so it's common among these children to see the presence of primitive reflexes on physical examination. And so these reflexes, we're born with these reflexes and they're protective in nature. And what happens is that as the baby moves around and passes through the birth canal, these reflexes are integrated into the nervous system. And so the integration of these reflexes is important for us in order for us to be able to process sensory motor information. In some studies, they have found that children who have experienced jaundice at birth are at greater risk of developing sensory processing concerns later on. And also the developmental milestones are very important for the development of the sensory motor skills. And so perhaps one of the most important milestones is crawling, which I will discuss in the next slide. But trauma impacts the child as well as attachment plays a role in the development of the sensory motor systems. And the reason why I'm highlighting all of these points for our children with FASD, on top of all of the challenges associated with the alcohol exposure and the impact on executive functioning, there's an extra layer of complexity that is often added here. And this is often not seen in other diagnoses. So for example, a child who's exposed to prenatal alcohol will already have some difficulty making sense of their world due to the nature of FASD. They may also have experienced violence in the home prior to adoption, or they may never have had a chance to crawl around and explore their physical world and practice these motor skills in order for them to develop their sensory motor system. So what we're looking at we're looking at several layers here that can affect how children process sensory information. And this can happen, despite having a loving and nurturing caregiver and attachment. It can be really difficult for these children to feel safe in their own bodies, even though they may have such a loving family who cares about them, just due to the nature of all of these sorts of things that can impact the sensory motor system. So let's get back to the importance of crawling and the development of the sensory motor system. When I'm out and I see a child crawling, I often comment to the parents how wonderful it is. And I often joke that, they should keep their child crawling as long as possible, because crawling is very important for the development of so many different skills. But what is ironic about this situation is that recently the Center for Disease Control, the CDC, has updated the guidelines for developmental milestones. And they have stated that crawling is no longer a developmental milestone. So this has been a hot topic of conversation on the pediatric OT pages that I'm a part of. In fact, many OTs around the world on an international page that I follow are very concerned because we see the impact on function for children that have not crawled for very long, or maybe have never crawled at all. And so we're always concerned when we see early walkers, because sometimes these children have never crawled. They've never had the ability to develop a lot of skills that will help them later on in life. And so, when we see lack of crawling skills, we often see children that have difficulty with reading, writing, emotional regulation, and postural stability later on in life when they go to school. So this photo of the baby here, it's fascinating because there's a lot going on when a baby crawls. So the baby in the photo is holding himself upright. His core muscles are working against gravity. They're providing him with postural stability. He's learning about how to use his arms and his legs together, how to shift his weight to balance himself. He's learning how to move his head independent of his body, and he's looking at something or someone. He's developing his tactile, vestibular, and proprioceptive systems while he's crawling. He's learning about depth perception as he experiences the world in this position. And he's strengthening not only his core muscles, but his shoulder girdle muscles and hips. And those are important for sitting upright and being able to focus at school in later years. I really always emphasize crawling. And if crawling is not a part of the child's past, then I try and use that skill or work on that skill and go back in developmental time and solidify those movements so that they actually develop that coordination. So sensory integration refers to the processing, integration, and organization of sensory input from the body and the environment. And simply put, this means how we experience, interpret, and react or ignore information that comes from our senses. And sensory integration is important for all things that we need to do on a daily basis, such as getting dressed, eating, moving around, socializing, learning, and working. And so what happens if the signals coming from our senses are too weak or too strong, or if the brain over or under reacts to the signals, or if the brain can't make sense of those signals at all? The individual will experience sensory integration difficulties, and this may be evident in their behavior. So some individuals may experience the sensory inputs as overwhelming and upsetting, leading to sensory overload. Individuals may be sensitive to sensory input or undersensitive, or they could have both, actually, depending on the situation. Children with FASD struggle with sensory overload. And remember that due to the FASD, they already have difficulties encoding information. and making sense of this information. So this adds another layer that is not always seen in children with ADHD, anxiety, or even autism. So when I go to Costco, I don't like lingering in the aisles. The lights in that store really bother me. I have a very low threshold for visual information in that setting. And I become somewhat dysregulated and I just want to leave. I may also wear sunglasses in the store, and then I'm okay to stay a little bit longer. And that is a sensory strategy to help me deal with my sensory processing issue. So many of us have sensory processing differences. However, they aren't really a problem for us because we use strategies in our daily life in order to help us get through those situations. So I have the skills to think about what I need to do in order to help myself. But if I had FASD, on the other hand, I may not be able to retrieve the information for myself. And if I were to have a little set of cue cards on a ring I could look at, it may help me be able to organize myself in this very demanding area. So this is something I use a lot with children who have FASD. On the other hand, I may not notice a buzzing fan in the background while I'm working on my computer. My threshold for auditory information is much higher than that of my husband, who may notice the smallest noises in the background, and that none of the rest of the family may even notice. So we all have sensory differences and threshold levels for the information that we're able to take in and process. So what we see in FASD is difficulties with sensory modulation. So sensory modulation involves problems that occur when our brain is either over-responding to or under-responding to sensory information. And I'll give you a little example here. For example, I had a little boy with FASD who could detect the most distant sound of a siren outside the clinic when he came to visit. I barely noticed it myself. However, this child could not settle himself as his nervous system response left him in a heightened state of arousal. And so he clung to his mother and he repeated over and over again, "Can we leave, mommy? Can we leave? It's too loud, mommy, it's too loud." And sometimes he wanted to escape the room. And so for many people working with children with this sort of difficulty, this sort of behavior looks like oppositional behavior. And this is why it is so important for people to understand the complexities of children with FASD and how the brain networks are overloaded, because this is not a behavioral issue. The incorrect way of dealing with this sort of behavior in the school system is to provide a reward chart. The child does not have control of the nervous system, and they just don't work. They end up feeling like they've done something bad because they didn't get a sticker that day, or they didn't get enough happy faces to take home to their parents. So these sorts of strategies really do not work for children with sensory processing difficulties. One of the best ways to deal with these issues is to give children a sensory motor break before they become overwhelmed and they realize that the child, what I wanted to say is that children do not really realize that they need a break. And so often teachers will say, "Well, Heather, they didn't ask me for a break," or they didn't say they needed a break. They didn't look like they needed a break. So what is important in our school system is that, teachers are aware that children are not in control of their nervous system when they are in a heightened state of arousal. They just can't think. Their cognitive brain is not online. They're really in a fight or flight mode. And so this is something that we're always working on in OT, is educating parents and educators and other people about how to deal with meltdowns and behavior when the child cannot control them. And it's hard, it's especially hard during this pandemic period because we can't get out, we can't experience the world like we did before. Children are overwhelmed, they may be on the computer screen for too long. We know that screens overstimulate the nervous system. And so our kids with FASD, they're often overstimulated by these things on top of already feeling that way. And so it's really hard for families. But rest assured that we're soon going to be getting back to daily activities like we were. And once the weather gets nice, we can get out to parks and get our kids moving. And hopefully some of these behavioral challenges will be resolved. It's not easy, but you're doing a great job. So I'd like to talk a little bit about sensory discrimination and perceptual problems. And this is when the brain has trouble making sense of the information it receives. If these problems are with touch sensory processing, an individual might seem clumsy, or they might use too little force when doing things. A child may put so much pressure on a door that whenever they shut the door, it actually slams. And so, they aren't aware of that because they're not processing the information the same way that you or I would process the information. And one of the biggest challenges in dealing with children with FASD is that, they may play too roughly with their younger siblings. And so they don't realize that they're being so rough because they're not processing that information. They're not discriminating that information correctly. A person with visual perceptual problems may have difficulties finding objects in a cluttered environment or finding a word on a page. Some children have difficulties with vestibular bilateral functional skills. And so these problems are a result of our vestibular sense, that sense of movement, and that can result in poor balance and difficulties with coordinating the two sides of the body. And then lastly, I'd like to talk about praxis difficulties. So praxis is the term for how our brain plans and carries out movements we have not done before. So for children, this could be learning to jump, learning how to catch a ball. And for adults, it may be learning to drive or to use chopsticks for the first time. So when sensory information is not processed, it can make new movements very difficult because the child does not have the ability to make sense of the different incoming sensory information. And so what happens is that they struggle to work out where their body is and how much force, speed, and direction is needed to do a new movement. And so we call difficulties with praxis dyspraxia or developmental coordination disorder. And many of our children with FASD have multiple diagnoses. They may have a diagnosis of dyspraxia on top of the FASD. So I'd just like to outline some of the frequently seen sensory challenges in children with FASD. Typically, most children with FASD have auditory sensitivity. They're very hyper aware to noise. They often are loud themselves, but they have a hard time like focusing and playing and being aware of what they're actually doing, whether it's homework or whether it's playing a game with their family. So little noises often bother children with FASD, even though they love to talk loudly. A lot of children with FASD really love to shout, and that is to kind of get feedback, auditory feedback for themselves, so they can actually feel like they're being heard and they get that feedback. Several forms of hearing loss have been reported in children with FASD. Conductive hearing loss, perhaps secondary to otis media, which is the ear infections, sensorial neural and central hearing loss. Atypical auditory processing has also been observed, and these impairments may have greater impact on speech and language development, reading and writing in FASD because of comorbid neurocognitive deficits. And these also impact the acquisition of skills. In terms of the visual system, children with FASD tend to be overwhelmed by stimuli and busy settings. The eye is directly affected through the direct toxicity of alcohol prenatally. And what I'd like to do is talk a little bit about the difference between sight and vision. So sight refers for our ability, it's our ability to see things. We can see things, we may be able to see everything, but we may have difficulty with vision. And vision is how we actually use our two eyes together. It's binocular vision. And so I've seen several children in the clinic where I've noticed they're playing, but their eyes are not working together. Their eyes are not teaming together, or they're not diverging or converging appropriately on physical examination. And so for these children, it's often suggested that they see a developmental optometrist to rule out any difficulties with binocular vision. And so we work very closely with developmental optometrists here in Ottawa to make sure that the eyes are actually working together, that the vision is actually, it's working well, and that the eyes are doing their job of visual scanning and all of the various skills that are in binocular vision. So one of the most helpful strategies I think I can suggest to limit visual clutter, or is to limit visual clutter in your child's environment. And so try to use dark, solid colored placemats at home in order to help your child focus while you're at meals. What this does, the dark placemat, is it visually gives the child a sense of where they are in space, and it can make a huge difference at meal times. Avoid multicolored sheets and distracting artwork in their room. And of course, this is easier said than done, but try and reduce the clutter at home. And using a visual schedule can also be very helpful. It helps to reduce anxiety by visually preparing the child and can be helpful in redirecting children to the tasks that they need to do or the steps they need to follow to get dressed or to pack their lunch or to do other activities to get ready for their day. Most children with FASD are overwhelmed by light touch. However, they often seek deep pressure or touch, and it is that deep pressure which is regulating for them. Using tag-free clothing can help with tactile sensitivities. We use the Wilbarger brushing protocol followed by joint compressions to help children who are hypersensitive to touch. Using an absorbent bathrobe can also be helpful as it reduces the need to rub the towel on the child's body if they're sensitive to touch. And so they just dry, the water is absorbed through the robe as they're walking around. They don't really need to be rubbed on their legs. Hypersensitivity to touch can also significantly impact feeding and picky eating as well. This is a common occurrence in the children I see with FASD. Proprioception-wise, children with FASD tend to overstuff their mouth. They often prefer the crunchy foods because the crunchy foods give them that sense of feedback as to where their muscles are in their mouth. And so, you know, it's also giving them auditory feedback. If they hear a crunchy carrot or if they hear chips or they hear crackers crunching, it kind of gives them that sense of, okay, where is the food in my mouth and where am I going to move that food in order to manage feeding skills. A lot of our children with FASD are very carbohydrate. They're carbohydrate lovers. They love crunchy foods, and it really helps them to process information. Toileting can also be impacted by multiple sensory sensitivities. The sound of flushing is dysregulating for them. There may be an echo in a public bathroom. Hand dryers are often difficult for children. And, you know, even when they're toileting, they need that proprioceptive body and space awareness to know where they are in space. And they also need interoception, which is knowing when you have to go to the washroom or identifying that feeling and being able to go. And so another thing I wanted to talk about was the importance of core muscle strength. And this can significantly impact toileting because children are not able to hold themselves up. And so I see a lot of children with very weak cores. And so this is often a goal in therapy, and we'll talk a little bit about that later. Children with FASD often seek vestibular movement or vestibular input, and this helps them self-regulate. They often, when combined with weak core muscles, they often have difficulties holding themselves up. And so they're in constant movement between trying to know where they are in space and also being vestibular seekers. Children with FASD, most of the children that I have seen have difficulty settling for sleep and staying asleep. And some of these challenges, the biggest challenges are for self-regulation at home and school and in the community. I also see some children with gravitational and postural insecurity. So they get very fearful of being, you know, up on a stand or, you know, on a bike. And so they have a lot of trouble sort of processing that information and feeling secure in their own body. So we'll often see these behavioral symptoms, right? And so, you know, it's important for us to deal with these sensory challenges before these behaviors happen. You know, so we'll often see, you know, shut down or avoidant behavior or children blaming others. Sometimes it takes so much energy for these children to keep themselves upright and to focus that they're just exhausted. They're frustrated, they get anxious, they get angry. And some of these children that have long-term anger issues, they get depressed. Children can get depressed. And this is really important for us to be able to integrate some of these strategies before some of this occurs, so that they don't develop such poor self-esteem in themselves, and they're not feeling like, they're not focusing well. It's a very common thing to see depression in children if they have long-term anxiety or difficulties with self-regulation. So some of the extra challenges that children with FASD have are that they have the slow processing speed. They are impulsive. They have difficulties making decisions. And so for the most of us, we have memories of what has helped us in the past. And so when we have to make a decision, we go into our neural bank and we pull out all of the information. Oh, this happened before, I'm going to do this, and this is going to help me. But children with FASD have a significant difficulty retrieving that information. So that makes it extra hard for them. They also developmentally, their developmental level is lower, and social behaviors, show that they generally act younger than their chronological age. We do see uneven development in various areas. And so children can be, the best at jumping, for example, and then they may have very poor fine motor skills. They may not be able to hold a pencil correctly. So we see a lot of uneven developmental areas. And they also have expressive language difficulties, or what I should say is expressive language is stronger than receptive language. And so combined with learning difficulties and memory challenges, this makes it more difficult for our children with FASD. So in occupational therapy, first off, I'd like to talk about what occupational therapy is, because many people think that we're out there to get them a job or to get them an occupation, which is not really the truth when it comes to pediatric occupational therapy. So what we're doing, the word occupational therapy comes from the word occupations. And so we're very concerned about people's occupations and helping children with their daily activities or activities that occupy their time. So that's where the word occupational therapy came from. So as a pediatric occupational therapist, our main role is to be a sensory detective. Okay, we work at really examining all of the different sensory systems to figure out what is going on. And each child is so different in how they present. We often do individual OT sessions with children. We provide programs and sensory diets for home and school and even in the community. And we help children when they get older integrate into the community or perhaps maybe into work. We also help with the design of sensory gyms, and we see children from birth to adulthood at our clinic. And one of the big things that we love doing is educating everyone about the brain and sensory processing and how important it is for functioning in everyday life. So in occupational therapy, we often do individual treatment. And so this is a photo of myself and one of my preteens with FASD. And we found that her nervous system really was relaxed when we applied deep pressure to her body. And so the balls in the back were rolled on her body, and she really felt a lot of muscle tension in her legs and in her arms. And so we did a lot of exercises to promote flexibility. And also here I'm releasing her Achilles tendon. And so she felt a lot of relief and just ability to relax once I was able to reduce some of the muscle tension in her body. And so once a child has reduced muscle tension, they're feeling a bit more relaxed, it really opens up their ability to communicate what they need, because they're holding so much stress in, and so they're able to communicate their needs. And so some of our goals for OT for children with FASD include developing self-regulation skills. I'd have to say that's the number one skill that we're working on, promoting independence for self-care, and getting children to be able to learn and do their schoolwork and even engage in leisure activities. So this is one of my favorite activities. This is a Lycra acrobat swing, and it has multiple layers of Lycra fabric or If you can think of the material that would be in a bathing suit, it stretches. And, you know, this little fellow, this was the days of pre-COVID where we didn't have to wear a mask. This is at our clinic in Canada, and we have all of these cushions. And so we're always working on body awareness and gross motor activities before we really get into fine motor tasks or other sorts of activities. But this swing is great. The little boy was asked to go up and down the swing and do flips and backwards. And as he's in there, he's learning about how his brain processes vestibular and proprioceptive input. And children just love this swing because it stretches against their body and they can actually feel their body. And so for our kids with FASD, this is a huge deal, is knowing where your body is in space and just feeling grounded. We also work on balance and coordination activities, and we talk about safety and how it relates to like where they're standing and what they need to be aware of. And so we're always relaxing the nervous system, and then we're challenging the nervous system so the child learns about their body and new experiences. So one of the most important things is that we use a child's strengths in therapy. And I put this little picture of this boy here. This is not my client. This is another photo, but I have this little boy who loves dogs. And so every time he comes into the clinic, he talks to the receptionist about his dog, and he always wants to tell us about his dog. He wants to see pictures of our dogs. He's fascinated by dogs. And so I will take that idea and I will use that in therapy in order to make a connection with the child, in order to gain their trust. Often during the therapy sessions, I don't work on a lot of the more challenging skills. The first few visits are really about making a connection and making the child feel safe in the therapy room, getting them used to the environment. And they have to be able to trust me, or they're not going to be able to progress in therapy. And so, you know, if I know a child is very musical, I may choose to have music in the background, or I may ask their parents, so what sort of music do they like? And so that's my way of connecting with these children. I do a lot of singing, and I use rhythm a lot in the sessions in order to get children regulated. And so we're really just building on the strengths and interests of the children, and we're having them do this in a safe environment. So I use these pictures of Mr. Bear here to show you some of the equipment that we use in occupational therapy sessions. This bear is sitting on a platform swing, which actually has 2 attachments, and we're able to get children to swing back and forth and also from side to side, depending on how it makes them feel. And this actually taps into the vestibular system. It's giving vestibular input to the child. So some children just love to swing, and that really helps to relax their nervous systems. And then the bear on the right, same bear going through therapy, is on this Montessori wobble board. And so what this board does is it allows children to work on their balance and their coordination. And again, it taps into that sense of body awareness, knowing, you know, where I am in space and how am I moving about. The bear on the left is actually using a little tool that I use a lot in therapy sessions. This is a handheld massager that lights up. And this little massager, I give it to the child to see how they respond to it in terms of tactile information. And it's very relaxing for some children to have this. Other children, they don't like it so much. But this is often a tool that helps children relax. And then the bear in the middle is looking a little bit tired because he's been jumping on the trampoline. So trampolines are great for children to get that proprioceptive input to their body. And so one of my favorite activities is actually getting children to jump and crash into a whole bunch of pillows. And what this does is it allows them to feel their own body, any sort of pressure. So any activities that require, you know, you jumping into something or pulling or pushing a heavy object, those are activities that feed into our proprioceptive system. And then the bear on the right here, we use a lot of weighted toys, we use a lot of weighted balls, and so we'll often play with weighted balls. And again, that provides proprioceptive input to the body. So rhythm helps to organize the brain. And so I often, if I have very dysregulated children, I will just try clapping very slowly. I might tap my foot to help them get the rhythm in the room going. I might tap their hands. I might get them to copy the movements that I'm doing on my own body, because tapping actually helps to provide that tactile and proprioceptive input, which helps with grounding. And then the metronome in the background is one of those traditional metronomes that you use if you're playing the piano to help set the beat. And so I like using the metronome regularly with my children. I set it at 65 beats per minute. And I just get them to follow my lead, and I tap with them, or I tap on their bodies, or I get them to tap on my body. I'll just say, tap my arm. And you can use a traditional metronome, or you can use a mobile application on your phone. You can download an app. And this is a really fun way to help children get organized in their body and their nervous system. So let's talk about the vagus nerve. So this nerve is a cranial nerve that runs from the brain down to our digestive system. And it's the longest nerve in the body. It's the nerve that plays a role in the parasympathetic nervous system. And that's our system response that's related to feeling calm and in a relaxed state. And the sympathetic nervous system, on the other hand, is our fight, flight, or fright, or freeze system response. And so in OT, we choose activities to help children relax by stimulating the parasympathetic nervous system. And so we choose activities that stimulate this nervous system, such as breathing activities. Ice is often used as another modality to increase vagal tone. And so if a child is overwhelmed and they're not responding to other cues, what we will do is have like a little ice cube in a face cloth, and we can put it on their head or the back of their neck. And what happens is that it activates vagal tone, or increases vagal tone. And so if you ever remember, being at home when you were a child and you were sick in bed and you had a fever, and your parents brought you a cold cloth to make you feel better. Well, what they were actually doing is that they were stimulating that vagal nerve, the vagus nerve. They were increasing vagal tone. And so ice is often helpful for kids with FASD if they're in a state of hyperarousal and you can't get them to calm down. We also use acupressure points to increase vagal tone. And so I teach children where they can press on their body in order to do this. I often show parents a little trick. There's 3 acupressure points in your body. If you get them to press in between the eyebrows for 5 seconds, below the nose for 5 seconds, and then underneath the bottom lip for 5 seconds. And you can repeat that. And that is a little tool that I use children to use at school. And so it may just look like they're thinking about something, but they actually are able to stimulate that vagus nerve in order to calm down. So I'd like to talk a little bit as well about the safe and sound protocol. And that is based on the polyvagal theory, which was developed by Stephen Porges. And the safe and sound protocol is a tool that we use in occupational therapy. And it is music that helps tap into that vagus system. And so it's modulated music that's been filtered, and the child listens to the music through headphones or a Bluetooth speaker. And this music exercises the muscles of the middle ear. And so it helps the ear to filter out high frequency from low frequency noises. And what it does is it relaxes the nervous system, and it helps the child to feel safe. And so by doing so, it makes the child more aware of their surroundings. It improves their ability to cope, and it can really help with focus, social interaction, and improving sleep. And so this program is required to be delivered by a certified therapist, and the child's progress is closely monitored. And you can find out more information about that on the Integrated Listening Systems website. I believe it's referenced at the end of this presentation. I wanted to give you some examples of activities and games that we use in occupational therapy with children who have FASD. We always start our sessions with gross motor activities that could include swinging, jumping on a trampoline, or having the child move his body. And the core muscles are key to having children feel grounded. And they're also important for breathing and regulation, which is something that nearly all children with FASD have difficulty with. They tend to hold their breath. They breathe high into their chest and not from their diaphragm. And many of my children with FASD are so busy telling me about things that they have a hard time slowing down their body. And so we choose games that purposefully require them to slow down and to get that proprioceptive or body awareness input that we were talking about earlier. And so this sort of, mini obstacle course picture here requires a child to follow directions, strengthens their core muscles. It works on problem solving and focusing. And so that's an example of just a mini obstacle course. And many children have trouble with balance, motor planning of the movement, like I said, and slowing down. The second picture is an example of a sensory bin that I use to work on visual discrimination skills and being able to find an object amongst an array of objects. It also involves having the child work on tactile discrimination, as we sometimes have them feel with their hands and then they close their eyes and see if they can find an object through touch alone. And for some children, these tasks are very overwhelming. So we may make it easier by having less items in a bin, or we might make the bin smaller. So there's different ways that we grade or modify activities in order to meet the needs of various children. So I once had an adult client years ago who described to me that taking a shower felt like having bullets being put through his body. Imagine what it would feel like if you took a shower and you felt as though there were bullets going through your body. So this adult at the time was able to express to me that he had this difficulty with bathing. But as a child, and particularly children with FASD who have trouble, making sense of the information and expressing themselves, they may have trouble, telling us about these things. And so they may avoid bathing. They may avoid tactile activities. And so what we're doing here is we're really helping the body to relax, and then we're challenging the child to introduce new things that may be difficult for them. And so we use the sensory bin to work on fine motor skills with that little tong set to sort activities and different objects throughout our therapy. And then we can work towards perhaps maybe working on visual motor skills or holding a pencil once those muscles are warmed up and the child is more aware in their own body. So by working on some of these sensory activities, we can help the child's nervous system to be relaxed, so we can work more on those skills that are very specific to what they're having difficulties with at school. For example, handwriting or sitting up and holding their body up against gravity, being able to focus. So no two sessions of OT look the same. Our activities and exercises are developed with the child's sensory profile in mind. And this is a standardized assessment provided to parents and educators that gives us a sense of their sensory needs, even before we meet them. And then we're able to clinically observe what's going on in the body and during our assessment, and we're able to challenge the child with the underlying skills that they need to develop. And so each child is different, like a puzzle, and we're really figuring out where all of the pieces go together in order for a child to succeed in tasks at home, school, and in the community. And I mentioned core muscle strength briefly before. So core strength is essential for a child to be able to sit upright in a chair, be able to breathe correctly. And we work on core muscle strength through the use of games and exercise and activities. However, many families don't have occupational therapy coverage, and this is a big problem for many families. And so what we do is we call on our colleagues who are physiotherapists at our clinic in order to help us help these children. And so if you see a pediatric physical therapist, they may also be able to help you with core muscle strengthening and building up these foundational skills that we need for regulation. And so there's a slight overlap between occupational therapy and physio for children. We both work on strengthening, but we may work on it in a slightly different way. And so for families without OT coverage, physio can certainly help address this area. So blowing bubbles here is a popular oral motor activity in therapy sessions. I explain breath control and relaxation by using yoga as an example. And so for those of you that do yoga, breath control is essential, and the breathing taps into that parasympathetic nervous system. A message is sent from our brain to our muscles to tell them to relax whenever we blow out. And so we really work on a lot of oral motor activities. Now, this is a difficult concept for children to understand, so we always make it fun. We blow bubbles, we get them practice in through your nose, out through your mouth, and you get to make a bubble volcano. We can add food coloring to make it more visually appealing for a child. And we just really have a lot of fun. So sometimes the best toys for learning are not the most complicated toys. So for example, this hedgehog game is useful for working on eye-hand coordination. However, if you immerse this toy in a bucket of water or a tray of sand, we're increasing the tactile sensory component. And so this simple toy helps children to work on color recognition, problem-solving skills, eye-hand coordination, and following directions. We could take this toy and hide it in a part of the corner, and we'd have the child take the individual pieces, crawl with the child with the peg on their back, and follow visual or written directions. And we really are making it useful for what the child needs to work on their level. So really the possibilities are endless. And if there are any pediatric OTs out there listening to this right now, they know that creativity and grading of activities can be so fun. So I chose this picture to talk about a young client's struggle with toileting. I have a young child who I see for OT, and he sees Stefania here, who is our occupational therapy assistant. And he has difficulty with reaching behind in order to wipe himself after toileting. He has the range of motion, he needs to do so. However, without that visual feedback as to where he is reaching, toileting has been very challenging for him. And he also struggles with getting his hands dirty due to tactile sensitivity. So what we did was we came up with this idea that he would work on his motor planning and how to approach the task by using this little outfit, if you would, our little outfit that we have. And so mom's goals for him included being able to develop more independence in the washroom. So during his sessions, he engages in a lot of jumping and crashing games to get that proprioceptive input. And he climbs the rock wall to work on his strengthening. And then what we do is we put this little outfit on him and he has to take the stars off. So he's actually practicing the motor planning movement in order to be able to reach behind. And then in the top picture, we have a sensory tray, which has shaving cream in it. And this was done over the holidays. The child has to put his hands in the shaving cream in order to retrieve the objects or the gems, the little erasers. So we can really make the sessions very fun for kids. And sometimes when the body is organized and they feel secure in their body, they're able to do challenging things, such as perhaps get their hands dirty when this is an issue for him. So this was a really big deal for this child because he was afraid that if he wiped himself, he would get himself dirty. And so the bottom picture too, I just put there to outline the fact that we use a lot of visuals for our kids with FASD because this really helps them to get organized. I'd like to talk a little bit about the lycra or neoprene bathing suit material that we use in our clinic. So it's stretchy, it allows for tactile and proprioceptive input in a variety of ways. And I just wanted to show you some examples of how we use this in our clinic. This picture on the left is actually just a little, it's a box. It's a cardboard box that we turned into a little sensory corner with some Christmas lights. We put a crib mattress in there. And on the side, you'll see some different papers that with different textures that children can reach for and get themselves feeling grounded. On the right-hand side, there's actually a swing underneath that little setup that we have. There's 2 pieces of lycra. And so children like to get in there and feel secure and swing. And also it's kind of cool because it looks like a superhero's cape too. So we've had that feedback from children. So this next example of using neoprene was a fort that I made at OCAT with a child who was coming to see me for the first time. He wanted to move the mats in the room. And so what I did while I was building trust and relationship with him, I allowed him to make a little fort. And I said, oh, why don't we cover the top with some lycra and we'll have a little fort. So anyway, he was feeling a little bit dysregulated and went in there and he was able to sit in there and get organized, and he had already moved all of those mats. So he had the proprioceptive input he needed. And then he came out and he engaged with the psychotherapist and myself, and he just felt more safe in his own body. And on the right, you may be familiar with body socks. They're also known as ghost suits. Again, it's a similar idea of the proprioceptive input. So these photos were sent to me of a mother of a preteen girl I see with FASD. And this child went through significant difficulty in the first few years of life. She was living on the streets and experiencing homelessness, lack of food, and had very poor attachment to her birth mother. And so here in therapy, we're actually using a lycra tunnel in order for her to crawl through, again, crawling on her hands and knees to get that deep pressure and to feel safe in her own body. And so using these tools for movement, helps to relax the nervous system so that children can open up about their past trauma. So we love to teach families about the importance of outdoor play. And these are some pictures of an obstacle course that we put together for a sensory motor station at an outdoor winter carnival for children with special needs a few years ago. And so our clinic was involved in having a little station, but I'm using these photos to just show you how simple some outdoor activities can be to set up. So we have like some tree stumps painted. We have a piece of board that is actually like a board that you walk on. And so it's teaching the child to walk slowly to the other side safely, to balance themselves. And so ideas can be really simple, but very effective. So I'm very thankful to this mom of this child that I see with FASD. She shared how much her child was enjoying his summer holiday and that he had so much fun in the sand and the water. And so as an OT, when I look at these pictures, I see a lot of skills being developed here. I see that he's working on integrating his sensory information he's receiving. He's working on motor planning and throwing rocks into the water, and he's working on his balance, his control of his body. And so outdoor activities are just so amazing for developing the sensory motor systems. Here are some examples of some home and school sensory room designs that we've been a part of. Again, the lycra is a big factor here. We have mats for safety under the swings. And so the child can get in there and just relax and organize their nervous system. And I have some children that use these sorts of rooms and obstacle courses before school to get organized for the day. So these pictures are from the same family. They designated a space in their basement for their 3 children who have sensory processing difficulties. And so what they do is they have their children go through this little ninja obstacle course. And the boys all think that it's so much fun. They use the stepping stones to work on balance and proprioception. They can get in the swing. They can climb the little rock walls, and they use those pull-up bars. And so they're really working at getting that information before school to help them focus. So our team of occupational therapists has really enjoyed collaborating and working with the professionals at OCAT, which is the Ottawa Centre for Trauma and Attachment in Canada. And a few years ago, we hosted Kim Barthel, who is here in the white jacket. She is an internationally renowned occupational therapist who travels the world to teach people about sensory processing and trauma. And so we organized a retreat, and she came and educated a group of psychotherapists and OTs about sensory processing, how it relates to children with mental health challenges and regulation issues. And so we were able to organize a workshop for families on being a sensory detective. And so that happened a few years ago. But I show this slide because it's really important for us to advocate for our children. Not many people know the value of OT, and often is not covered. And so what we need to do is just really advocate at our workplaces that occupational therapy be covered, because it's something that often is not covered. They may cover psychotherapy, but not OT. And so really the child might need both. And so I believe that community education and advocacy for our children is critical. And so FASD is an area that requires a lot more research and support for families. I spoke with another occupational therapist who does research in the area of FASD, and she's from Pennsylvania. Her name is Dr. Mary Colshaw, and she has invited our team of OTs from On the Ball to become involved in some research related to children with FASD. And so this is an exciting upcoming project that we're looking forward to. So I must say that occupational therapy is significantly underutilized for children with FASD, but it can really help with so many of their behavioral challenges if we really look at the underlying sensory processing differences, and we really look to help organize that nervous system. So about 7 years ago, I created an OT page on Facebook, and it is entitled On the Ball OT Ideas. And on that page, I regularly post ideas to work on sensory integration skills, fine motor skills. And so I never imagined it would be so huge, but they now are about 2,500 followers of that page. And so that just tells me that our community really needs this information. So psychotherapy and occupational therapy work really well together because we're trying to foster safety and connection in children, and they need to feel safe in their own bodies in order to do so. And so we work very closely with the psychotherapists at OCAT in order to do this. Sometimes we have individual sessions with children, or sometimes we actually have joint sessions. And so when children feel safe in their own bodies, they're able to talk about their past trauma or able to express themselves better. And one of the moms that sent some of the photos for this presentation also sent me a little message about what she noticed with her child. And I must admit, it made me a bit emotional to read it, but I decided I'd like to share it here. She said, "My child couldn't sit still in her attachment therapy. She was dysregulated most of the time and silly. She flopped around and groaned. She pulled her coat up over her face. She changed the subject frequently and couldn't tolerate hard conversations about her FASD or trauma experiences for more than a couple of minutes. She had an excellent therapist who worked gently with her many distractions. As occupational therapy began to be increasingly a part of her sessions, we started to see a change. And on the swing, she was able to talk about her challenges she was feeling and reflecting on. And she would swing hard from side to side as she talked. And sometimes it was the big ball that she needed. She would do a back bend over it and talk about her day. And when she became agitated, she asked for what she needed or started to swing herself harder. The movement settled her, and she seemed to be able to access words for her feelings and experiences in a way that she normally couldn't." That's from a mother of a 12-year-old child with FASD. So On the Ball has 2 clinic locations, one in Canada and one in Orleans. We just wanted to show you the pictures of our Canada location where I work. And so I also see children out of the OCAT location as well, which is more of a quieter environment. And we have several types of different rooms that are catered to children with various needs. So can you tell I have a lot of fun at work? I rest very well at night because I get a lot of exercise during the day. Here are a couple of other examples of spaces that we make smaller for children with body awareness challenges, proprioceptive difficulties. And this is a picture of one of our OT rooms. And so I just wanted to highlight some of the resources or websites that may be helpful for you as you learn about sensory processing and challenges and how they impact behavior. This is one of my favorite books. It's called Beyond Behaviors by Dr. Mona Delahook. It just really is a great book that explains why we see these behaviors in our children. And it's an incredible resource. So I just wanted to thank you so much for inviting me to speak tonight. If you'd like more information, our contact information is up on the screen here, and we would be more than happy to help you and your child or the children that you see in group homes or provide support. Thank you so much for having me.
Thank you, Heather, for this great presentation. And most caregivers present tonight are really appreciative of the level of detail and the strategies that you provided. Can you speak more about what a sensory diet is?
So a sensory diet is a personally designed list of activities or exercises that's used in order to meet the child's sensory needs, in order to help them get organized in their nervous system. It helps them focus, it helps them feel calm. And so what might work for one child may not work for another child. And so this is why an OT can kind of look and see what the specific challenges are, and then something specific can be developed. And this is something that we do all the time for teachers in the schools, because they're like, how do I help my child, my student, because they're so dysregulated, like, what am I supposed to do? And so we really develop this sensory diet. It's just like a list of activities and exercises that really help the child to focus.
Can you speak a little more about early intervention and diagnosis? Not many people know that FASD may be at stake, and they often find out much later. But what can an OT do to really help people reach the milestones of their development? and how can you be part of early assessment as well?
Yes. So at our clinic, we see a lot of children who are on wait lists for assessment. You know, the child may be struggling because they're not moving properly, or they're not regulating, they're not feeding. And so I really encourage families to reach out for help even before they get an assessment, because some of these interventions can really help. And we know that the brain is very what they call neuroplastic at this young age. You know, we learn things and we integrate information here at a young age, and we can make some significant changes in the nervous system for these kids. And when these kids are better regulated, they're better able to function, and they're better regulated. They sleep better. And you know, OT is not a cure for FASD, but we can really make a significant change in the functional activities that children do every day.
Someone else said, I've heard that many children now don't crawl much, if at all, because they now sleep on their backs rather than their stomach. So they're not developing the skills to put themselves up. Can you speak into this, whether or not FASD may have a connection to that as well?
So a lot of children don't like being on their tummies. And so, you know, during the movement where children were always told to put their children to sleep on their backs, a lot of children weren't getting that tummy time that they need in order to develop the strength of their postural muscles. And so when babies are on their stomach, they're exploring their world, and they're actually mapping out the proprioceptors, which are the neuroreceptors at the back of their head. They're lifting their head up, and they're seeing where their body is in space. And so children who may have gastrointestinal issues, or they may be fussy on their tummies, they don't like being on their tummies. And so often parents will not put them on their tummies because it's very upsetting for them. And so that's really important for children. And so if you can't do that, what we do as therapists is we encourage families to hold their children, you know, tummy down, so they are getting a little bit of support, like they're being held like this, they can lift their head up and look around. We may put them on an exercise ball or a cushion, so something that is a little bit more comfortable for children. But again, we relax the nervous system, and then we challenge those areas of the nervous system that's more difficult. And so you can work a lot on positioning.
How exactly does movement help with self-regulation? Why do we ask children to move to calm them down?
Yes. So as I talked about, the vestibular system is important. And so, you know, some children may have a high threshold for vestibular input. They may seek that vestibular system in order to be organized at the nervous system level. And so we call that reaching their sensory threshold. And what happens is that there's actually a neurochemical downregulation in the brain that helps us focus when we've received when we've met our sensory threshold. And so some children have an extraordinary need for movement. And so that's why it helps them with focus. And so movement just helps children feel their body. It helps them know where they are in space. And so that's why it's such an important part of regulation, specifically in the schools.
How does stemming fit into the sensory issues? For example, clapping, yelling, banging on desks. And if you can speak into perseveration, I would say as well.
Yes. So stimming is actually a way for children to release energy from their body. And so there's a lot of talk about, you know, eradicating these behaviors in children, but these stimming behaviors are actually really helpful in order to get like a release of energy for these children. And so they actually will, you know, bang on a desk, or they may flap their hands. And so the thing that's important is that you shouldn't tell kids not to do these things, because it's out of their control. Their nervous system is not recognizing that they're doing this. They're not aware of this. And so it's important not to verbally tell your child not to do these things, but perhaps if they're banging on a desk, we can introduce some activities that also meet that sort of sensory release, or that need in order to like settle themselves.
Any suggestions to address bedwetting for a child with FASD?
Yes, so we see a lot of children at our clinic who wet the bed, and often those children have a retained spinal gland reflex. It's a specific reflex that should have been integrated during the birthing process and early childhood movement. And so on physical examination, we can often elicit that reflex. And so we provide exercises and sensory stimulation to the spine or the side of the spine in order to make the child more aware. And so that often, as that reflex is integrated, you'll see less and less bedwetting. In fact, I've seen teenagers who still wet the bed, and on examination, they have the spinal gland reflex. And so, in combination with a weak core and that spinal gland reflex, children often have a hard time controlling their bladder, and particularly at night. And so I would recommend that those children go and see a pediatric physical therapist or occupational therapist who is specialized in reflex integration, and who can help them with the bedwetting concerns.
I've worked with adults as well with FASD who had problems that could have been addressed with an OT, for instance, hygiene, and the staff that were supporting them were thinking it was anger management classes they needed to, when it actually they couldn't reach or use a shower properly by themselves. They need help. Can you talk more about how you can support people across the lifespan as well?
Yes, so I actually see some adults with sensory processing challenges, and we work on things in a slightly different way. We work at adapting the environment. The difference in working with adults is that often they understand a little bit more, and I can explain what's actually happening in their body. Whereas working with children, it's very hard for children to understand what we're talking about at a very young age. And so we adapt the environment. I give them sensory diet activities that they do throughout their day to help them get regulated so that they can focus better at work. And so OT is really it's across the lifespan. I primarily work with children, but I also see a lot of adults with sensory processing difficulties. And, a lot of these people, they could have undiagnosed FASD. I think it's quite underdiagnosed. And, they may not have ADHD or autism, or, they may have had traumatic experiences that present themselves with, present as sensory processing challenges. So there's a variety of diagnoses that look very similar. So, sensory processing is often a challenge for people that have been through traumatic experiences, as well as children with FASD.
And trauma may present very similarly to FASD as well. And attachment sometimes is not at stake, and sometimes it is. Sometimes it's all three of these issues at once. So it's very tricky. Is the vagal system a feeling of burning like heat? Is that why ice helps?
When a person is stressed, you'll often see children with red ears. You might see increased heart rate. You might see them itching at their body, or you might see their pupils dilating. And so these are all signs that a child may be in physiological stress due to their nervous system. And so, it may feel as though they could have a burning sensation, but really ice sort of taps into that vagus stimulation right away. And so it's like a really effective way to tap into that vagus nerve and to increase vagal tone.
You mentioned that body scans are a good approach to developing the interoceptive system. Would biofeedback be another good approach to help develop this? And there's many other approaches, such as brain spotting as well, that's been very successful. So can you speak about?
So I am not very familiar with brain spotting, but I have heard some amazing things about what it does and how it helps people. So biofeedback is actually what I was using with that pulse oximeter. I was getting the child to put it on their finger, and it was looking at the information. It was providing that information. But yes, there are various modalities out there that perhaps I'm not familiar with, such as neurofeedback. And it's certainly very interesting when it comes to helping these kids. And what might work for one child may not work for another. And so we just need to know that going in. We do our best and we see what works. But due to the complexities of FASD, and all of the sort of underlying challenges and neurocognitive deficits, sometimes, it's not a one solution fix all sort of thing. So we have to trial certain things.
Do you find that OTs need extra training on FASD for their work to be beneficial with kids with FASD?
In Canada, we don't have a lot of occupational therapists who are trained in sensory integration. And this is one of the reasons why I went to the United States in order to become trained in this. We don't receive this training in regular OT school. All of this training is sort of post-professional, postgraduate training. And so if you're looking for someone to help you with your child, my recommendation would be to seek out someone who has the specific knowledge of sensory integration particularly. I started to see more and more children with FASD once I got involved at OCAT, because we saw the need for us to work together. The psychotherapists were having a hard time. Sometimes they'd have a hard time getting the child to speak in therapy. And so, when I met the psychotherapist at OCAT, at a course actually in Toronto, we came back to Ottawa and we said, you know what, we can help these children together. And so that's what we've done. And it's made a significant impact on the child's ability to regulate and talk about their problems with the psychotherapist. And so psychotherapy and OT, they marriage very well. They really are, it's a beautiful combination of expertise, and we work together and we really are able to help children. So, but if you do a Google search, please look up sensory-informed, trauma-informed occupational therapy. And if they're using sensory integration and reflex integration in their practice, then it's likely the practice for you.
Well, thank you so much, Heather, and good night to everyone.